Pancreatitis is the most common complication following endoscopic retrograde cholangiopancreatography and occurs in 1 to 30% of patients. The incidence of post-ERCP pancreatitis is higher in patients with certain demographic, clinical, and procedural factors, and these patients are considered to be high-risk patients. Multiple randomized controlled trials have shown that pancreatic stents significantly reduce the risk of PEP compared with no stenting in high-risk patients. Pancreatic stents are thought to prevent PEP by preserving pancreatic ductal outflow, which is often compromised by ERCP-induced papillary edema. However, it's not known which pancreatic stent is most efficacious for preventing PEP in high-risk patients, as previous trials have assumed that all stents are equally effective. Pancreatic stents vary in diameter, length, presence of internal flanges, and type, straight or single-pigtail. Therefore, the choice of which stent to use has been largely left to the discretion of the individual endoscopist. Afghani et al. Have conducted a network meta-analysis to evaluate the efficacy of various pancreatic stents for the prevention of PEP among high-risk patients, and to determine whether there is a particular feature of the stent that is associated with a lower incidence of PEP. They report the results in the paper entitled 5 French versus 3 French pancreatic stents for the prevention of post-ERCP pancreatitis in high-risk patients, a systematic review and network meta-analysis. Methods. Network meta-analysis. Several randomized studies have evaluated the efficacy of different pancreatic stents. A network meta-analysis was conducted to determine whether there is a particular feature of these stents that is associated with a lower incidence of PEP among high-risk patients. A standard meta-analysis is limited as it only allows for comparisons between a pair of interventions. An NMA allows for simultaneous calculation of pairwise odds ratios between multiple interventions and provides a rank for the relative performance of each intervention. NMA combines evidence from RCTs by indirectly comparing competing interventions through a common comparator, usually placebo, or, as in the present study, to no stent. Background and study aims. Placement of a pancreatic stent is recommended for the prevention of pancreatitis after endoscopic retrograde cholangiopancreatitis among high-risk patients. However, it is not known whether there is a particular feature of the pancreatic stent that is associated with a lower incidence of post-ERCP pancreatitis. In the systematic review and network meta-analysis, the aim was to examine whether a particular feature of pancreatic stents is associated with a lower incidence of PEP. Patients and methods. The Medline, MBase, and Cochrane library databases were searched for randomized controlled trials that evaluated the efficacy of pancreatic stents in the prevention of PEP from September 1993 to June 2013. Trials that reported the incidence of PEP in high-risk patients randomized to one versus another type of pancreatic stent or versus no stent at all were included in the analysis. Results. Among the 1,377 citations identified from the database searches, 6 RCTs involving 561 patients were included. 3 RCTs evaluated 5 French straight flanged pancreatic stents, 2 RCTs evaluated 5 French single-pigtail unflanged stents, and 3 RCTs evaluated 3 French single-pigtail unflanged stents. The probability of being ranked the best was 50.3% for 5 French single-pigtail unflanged pancreatic stents, 46.5% for 5 French straight flanged stents, and 3.1% for 3 French single-pigtail unflanged stents. Conclusion: the 5 French pancreatic stent is superior to the 3 French pancreatic stent for the prevention of PEP in high-risk patients. The 5 French single-pigtail unflanged pancreatic stent and the 5 French straight flanged pancreatic stent performed similarly, and both performed better than the 3 French pancreatic stent in preventing PEP, suggesting that stent diameter is more important for the prevention of PEP than type of stent or the presence of flanges.